Okay, so welcome to Living It Up with Lynette. This is a web series dedicated to helping you live your best life at any age. And I'm so happy to be here with you today. This is a joint effort between Caregiver Volunteers of Central Jersey and Friends Health Connection, two New Jersey nonprofits that are dedicated to making life better for others. So I am so happy today. I am so honored and thrilled to introduce Dr. Stephen Masley as our first guest. And I'm going to tell you all about Dr. Masley and his wonderful book and wonderful advice. But first, I want to preface this by saying that any information provided during the show is for your general knowledge only and is not a substitute for professional medical advice or treatment for specific medical conditions. You should not use this information to diagnose or treat a health problem or disease without consulting a qualified healthcare professional. Please consult your healthcare provider with any questions or concerns you may have regarding your condition. So with that being said, welcome, Dr. Masley. Thank you for joining us today.
Hi, Lynette. I'm very happy to be with you.
Wonderful. And you're coming to us from Florida, correct?
I'm in St. Petersburg, Florida.
Okay. Did you have iguanas falling off trees there?
Not in our area. We don't have, no, it's too cold up here in St. Pete regularly. They're down in South Florida. But
okay. Well, that's good to hear. So let me introduce you to our audience. Dr. Stephen Masley is a physician, nutritionist, trained chef, author and creator of the #1 health program for public television, 30 Days to a Younger Heart. He helps motivate people to tune up their brain, heart, and sexual performance. He is a fellow of 3 prestigious organizations: the American Heart Association, American College of Nutrition, and American Academy of Family Physicians. His research focuses on the impact of lifestyle choices on brain function, heart disease, and aging. His passion is empowering people to achieve optimal health through comprehensive assessments and lifestyle changes. Again, welcome to this show. So your latest book is called The Better Brain Solution. Yeah. And I just want to thank you so much for writing this book, because I think it's something that people don't pay attention to enough. It's not really in the popular media about that you can impact your brain and make a change in your life. And so by elevating this and educating people, I really applaud you for writing this. So thank you so much for doing that. What brought you to writing this book? What motivated you to do it?
Well, in my clinic, we do 100 markers of aging. So over the last 15 years, we assess, are you growing plaque in your arteries, bone density, lab markers, but also brain processing speed, memory, overall cognitive function. And we compare that with, we look at the foods you eat, the nutrients you get, your fitness, your stress management, and your toxin exposure. And we've been able to publish and show which lifestyle choices accelerated artery plaque growth and memory loss, and which ones improve your brain function. We've actually used that, created a 5-step program to improve brain performance. And we've shown in randomized clinical trials and published this, that our average patient improves their brain speed by a whopping 25%.
That's amazing.
So pretty amazing that we're able to help overall health, but specifically help prevent heart disease and help improve brain function at the same time we're helping to prevent memory loss.
It's amazing. And I think you get to a certain age, and every time you walk in a room and you forget your keys, or you go into the kitchen and you're like, why did I go in the kitchen?
What did I come for?
Exactly. It's in the back of your mind. Oh my God, is this the start? What's happening? So it's so nice to know that you yourself can take some control over your brain function. It's a wonderful, comforting thing to know.
Yeah, I think we can prevent at least 60% of memory loss, maybe up to 90% if we follow all the steps and do everything right.
Amazing.
So we can make a dramatic change in preventing the #1 scariest and most expensive disease in America today.
So the thing that when I read your book, I was curious about, and I'd love your input on this, is that it seems like the American Heart Association has done an amazing job with educating people about heart disease. And pretty much everybody knows with heart disease, you have to get off the couch and eat healthy. It seems like in the world of Alzheimer's or dementia, it hasn't really bubbled up to the surface that there are things that you could do to make your brain function better and prevent Alzheimer's disease. Why do you think there's that disconnect between talking about it with the heart and talking about it with the brain?
It takes decades to change our public messages. And I think for over 20 years, we've known that we could, through lifestyle, prevent heart disease. I can remember in the 1980s giving my first lecture at the University of Arizona on, improving cholesterol could prevent heart disease. And that was considered new in the 80s, but we've been doing this a long time. Until just recently, we thought the brain couldn't be fixed and there was nothing you could do about it. So it's pretty recent that we know that you can prevent memory loss, that you can prevent Alzheimer's, that you can actually improve your brain function. And it's going to be a while, maybe I don't know, sadly, it could be a decade before the moves gets out, unless people like you and I get to it sooner,
Right.
And that we make a difference in getting the message out that, hey, not only can you prevent memory loss, you can make your brain better starting today. Let's get at it. And I think this is really new information, and we've got to get that message out.
Yeah, and that's why I'm so appreciative for you for writing this book, because again, it's not really in the popular culture or media. And just yesterday on the internet, I read that Pfizer was pulling some research. They were developing drugs for Alzheimer's disease, and they're pulling it because it wasn't.
They dropped them.
They
don't work. None of the drugs stop the progression of Alzheimer's. So why they're spending hundreds of millions of dollars on drugs that don't work? You stop it. But we can prevent it with it. We don't need those drugs.
Right.
We can actually prevent this problem. I mean, I wish there was a pill that we could give that worked. I mean, wouldn't that be nice? But there isn't.
Right.
So,
Right.
I mean, it's not that I wouldn't love to have that, but it's not there. I don't see it happening in the next 10 years.
Right. I don't either. Yeah, that's why I think your book is so important, and especially for people who, before they develop the symptoms, to read and really jump on board. So let's talk about the nuts and bolts of your book. So you mentioned briefly before that there was 5 sort of pillars that you recommend to people. Can you just talk about them a little bit more, and what those are and what people can do?
Well, number 1 is food. There's clearly foods we should add. You know, in the Better Brain Solution, I offer 12 foods people should eat that are shown to be good for their brain and preventing memory loss. And we should eat those regularly. It's easy, like dark chocolate and berries and green leafies. I mean, it's not that hard. And there's foods that we need to avoid, like sugar and flour, that cause the number 1 cause for memory loss is insulin resistance and abnormal blood sugar control. So foods first, but nutrients are important too. There's specific nutrients we need to help prevent memory loss, and deficiencies are really common. Number 3 is fitness. We need to add physical activity. It's essential for our brain, both aerobic activity, we rev up our heart rate, and strength training independently. They both really help blood sugar control and brain function. Number 4 is stress management, that if we're chronically stressed, and think of all these caretakers taking care of people with cognitive decline, that's stressful. If they don't take steps to manage their stress, they risk elevated cortisol, which literally shrinks the brain center. We don't want shrunken brains. We need to manage our stress. And 5th, there's brain toxins that are easy to avoid that hurt our brains, and we need to identify where are those toxins, how do we avoid them, and protect our brains from accelerated cognitive decline.
Yeah, and I love in your book that you make it so simple, that you said, here's a shopping list. You make it as easy as possible for people to follow this, your recommendations. So for foods, you talked about like the leafy green vegetables and the dark chocolate and things like that. And you say that it's just like adding 1 thing a day or twice a day. It's not like
there's a dozen foods I like to add. Some of them are just pigment based, like green leafies. If you eat a cup of green leafies each day, your brain is 11 years younger than the average person who doesn't. And 11 years, that's a lot.
Mhm.
from one, I mean, come on, we can eat a cup of broccoli or kale or Swiss chard or something in there to make that difference.
Mhm.
As I said, berries, but other vegetables, any of the colorful vegetables work, any of the colorful fruits work. But berries and green leafies being some of the, and beets would be some of the best. Dark chocolate you mentioned, green tea, the pigment in green tea is good for your brain. People should be drinking green tea. And it's okay to drink coffee. 2 cups a day is also good for your brain. Those coffee pigments have benefit. Well, even if it's decaf, it's good for your brain.
Right.
But too much coffee is harmful. So there we need moderation. And in speaking of moderation, a little bit of red wine appears to be good for your brain too. A glass a day with dinner is a good thing. More than 3 glasses is clearly harmful. So if you can't control your alcohol intake, then don't start. And sorry to say, but beer and hard liquor don't really work for your brain. So
Oh, well.
it's red wine or skip it, and don't overdo it. I mean, that's kind of straightforward. But fat is also, our brain is mostly fat. So we need like olive oil and nuts, and dark chocolate has healthy fat, and especially seafood. The long chain omega-3s come from like wild salmon and sardine and mussels and oysters, and you know, that's 40% of our brain by weight are these special fats. So, you know, the latest study showed that a low-fat diet versus a Mediterranean diet, when they added nuts or extra virgin olive oil, cognitive function got better. It slowed and prevented memory loss. And people on a low-fat diet had accelerated memory loss. So, I mean,
Yeah.
at least from the brain perspective, I think we're done with this low-fat diet mistake that we've been trying for years.
Right. And you talk a lot in your book about insulin resistance and how what an important role that plays. And I think, as you say in your book, most people think they go to the doctor, their blood sugar is 100 and less, and they feel like, okay, I'm good, I don't have diabetes, cross this off my list for the next year. But you make the point about insulin resistance, and so I want you to talk a little bit about that. But I also wondered, like, my doctor has never said to me, you know, you should have a test for insulin resistance. It just never comes up in the conversation. Is that something that people could ask their doctors about?
Easy, easy. Just,
Okay.
you know, what's my fasting blood sugar? It should be less than 95 milligrams per deciliter. So,
Right.
and then what's my fasting insulin level? It should be less than 5. So, I mean, but let me explain that before we talk about numbers. Insulin's the hormone that tells your body to store energy inside your cells. So when people eat like carbs, whether it's something healthy like green leafies and blueberries, or whether it's, you know, something that causes blood sugar abnormalities like sugar or flour, when we eat those carbs, they come in, they pour into our gut, and insulin says to your cells, store it away as energy. Like your muscle cells make glycogen and store it away. But eventually, if you eat too many of these refined carbs, your cells are full, and they can't take any more energy, and they become resistant to insulin's message. But insulin resistance does a lot to our brain cells. Our brain cells basically shut down and stop working when we become insulin resistant. So when people eat a lot of sugar and flour, they literally turn off their brain. They have more brain fog. They're more forgetful. They forget more names. They forget why they walked into a room. That's what happens when we eat too much sugar and flour. Now, if it's a day, okay, your birthday, not such a big deal. But if it's every day, not only do you have cognitive dysfunction, but your brain cells become dysfunctional and they start to die, and then your brain starts to shrink.
Yeah.
So insulin resistance is like the #1 cause for accelerated memory loss and brain shrinkage. It's something we got to prevent, and it's increasing rapidly. 50% of all baby boomers have insulin resistance. That means 50% of people are high risk for memory loss and heart disease, and 30% of all adults. But I mean, if your audience like mine is mostly baby boomers, I mean, half of them, this is a national crisis. And that's why Alzheimer's rates are expected to double in just the next 12 to 15 years. So right now, it's the #1 scariest disease and the most expensive disease, but it's going to double just over a decade. That's a tragedy we've got to prevent.
Right.
And we can do that by just changing our choices that we make in our lifestyle, and save ourselves and our loved ones too.
Right. And this message just has to get out so loud and clear to people before it's too late. It just really, it just makes such a huge difference. So you could have an absolutely, your blood sugar could, fasting blood sugar could be 95, but your insulin could be elevated, and you
Yeah,
would
it could be
absolutely
10,
know.
15, your
Right.
insulin
You would not know.
resistance,
Right.
you're hurting your brain and you don't know it. But
Right.
usually there's other signs. Usually if you have brain fog, that would be the sign.
Mhm.
If your waistline's expanding, I mean, so what are the systemic signs of insulin resistance before you have brain deterioration? Your waistline's going up, your blood pressure goes up, your triglycerides go up, your HDL cholesterol drops, you're more inflamed, you're more achy. All those things happen 10 years before your blood sugar levels go up. So you can have insulin resistance for a decade, be injuring your brain, not know it. And then eventually, yes, your blood sugar goes up. But honestly, most doctors, when your blood sugar is 102, 105, and it's only a 10-minute doctor visit, I'm not sure they always address it. They could just say, oh, you're fine. You don't have diabetes, you're fine. You're not fine. You have accelerated aging. You're losing your memory. You're causing heart disease. That's not fun. And we can reverse and change that with this better brain solution.
Well, I think people, because there is such a high incidence of Alzheimer's, and there are so many caregivers out there, they see what's going on, they see the toll it's taking on themselves. And I think those people this is really going to talk to them like, I don't want this to happen to me. What could I do to prevent this from happening for me? So there's this whole tsunami of caregivers out there that is going to be really looking at this information to help themselves, especially adult children. I think I mentioned to you, I live with my mom. She has Alzheimer's disease. I took notes from your book. I don't want to do this to my children. I don't want to be in this position.
Well, that's the worst of it, right? It's not just that we lose our identity and we suffer ourselves. The worst part is we become a burden on the people we love, and nobody wants that.
Exactly. So let's talk about the exercise part of it a little bit. You talk about the aerobic exercises and then the weight training exercises. Talk a little bit about what's your best recommendation, how to get started in this, because I think there's a lot of confusion.
The first step is just to get moving. People need movement. That public health message, 10,000 steps a day. It's a really good one. That when you add aerobic activity and you just start moving more and you start walking, that improves brain function. You actually improve your brain speed significantly. And activities, at least the research from our clinic and other studies have shown, it is like the most powerful predictor of preventing memory loss. So we need to be aerobically active.
Mm-hmm.
I think one of the surprises for me with our published research was that strength training is also independently really important. And when you add muscle mass, you help prevent, you improve your insulin blood sugar control. You help prevent insulin resistance by adding more muscle mass. So it really has a benefit. So we want some aerobic activity and we want strength training. Just something like 15 to 20 minutes twice a week can make a really big difference in building muscle mass and improving brain function.
Yeah, and I think that people think like, oh, I have to go out this weekend and run a 10K, or I have to I have to get out there and do it, and then you get hurt and discouraged and everything. So your advice is just start small. You have those different steps.
I start with 3 steps. Step number 1 is just get up to 10,000 steps a day, whether it takes you 4, 6, 8 weeks, get there and stay there.
Mm-hmm.
Then the second step is really to start getting your heart rate up so you sweat and you add strength training, because that's the biggest benefit is when we start to rev up and we get a little sweaty and short of breath and we add some strength training. That's when we really get a big brain benefit. Our data in our clinic showed we saw up to a 30% improvement in executive brain function, brain processing speed, when people added a mixture of aerobic performance and strength training. It was really powerful.
Yeah. And which brings directly to stress, because as you mentioned in your book, stress is so reduced by doing exercise. And it's so, we live in crazy worlds and we're stressed and we're busy. And
the politics, the world situation, everything.
Everything, yeah.
Our phones that reach us 24/7. Everything is making life more stressful now. So, Yes, it is important. And high cortisol will literally shrink your brain. And we get high cortisol from uncontrolled stress. You know, we lose muscle mass, we lose bone mass, it raises our blood sugar, we grow more plaque, but we definitely don't want to be shrinking the hippocampus, the memory center. And that's what cortisol does. So exercise is really good. Adequate sleep is essential for stress management. But meditation, adding 10 minutes of meditation each day is very effective. You know, people can use prayer, deep prayer time, and not, you know, like praying for something, but that meditative, like focusing our breath, our breathing, being with spirit, being with God, however you want to do it, 10 minutes a day is really calming and very effective.
Right. And I thought your point about just sort of disconnecting before you go to sleep, as far as turning off the computers and the screens. And did you say 2 hours or a half hour before you go? At least
an hour, preferably, we should get off these, you know, screens, whether it's the TV or a computer or a phone. That white light stimulates the hypothalamus and tells us to wake up. You're not going to sleep well when you're blasting your face with white light before you go to bed. At the very least, put on red amber sunglasses so that you're getting like that sundown effect the hour before you go to bed. So if you are going to watch TV, I mean, it'll look funny, but you should be wearing red amber colored sunglasses when you do it.
So at what point, like when somebody has mild cognitive impairment, there still can be improvement? Like, is it, at what point should people say, like, it's not too late for me?
No matter what your score or what we've our clinic, no matter what your age or what your score, you can still improve your brain function. It's never too late.
Wonderful.
80-year-olds want to increase the size of their brain by doing the right steps.
Wonderful. All right. Well, we have about 5 minutes left. So I wanted to ask you, what is the one piece of advice that you would like to leave people with, or what would you like to mention to people before we have to wrap this up?
Well, I think most people normally procrastinate. And with your brain, it's a really bad idea, because if you're waiting till you become forgetful, you're forgetting names, you're walking the room, you don't know why you're there. If you're waiting that long to take action, the reality is your brain is already shrinking. Don't wait till you have a shrunken brain. For goodness sakes, take steps to protect it. The good news is that if you follow this easy to follow 5-step plan, you can improve your brain function by 25%. You can prevent heart disease, memory loss. You can dramatically improve the quality of your life and feel fantastic. Don't wait till you have a shrunken brain to get going. And that's what most people naturally would do. So what the heck? Jump in, get started. Who doesn't want a better brain? Let's make sure you take steps to improve your brain starting today.
Wonderful. Yeah, and that's why I love your book, because you just give real practical advice and stories. And we didn't have time to do it, but I want to encourage people to, you have a quiz on your website, which talks about, you know, like some of the steps, some of the things that you might be experiencing right now. So I want you to give everybody your contact information and your website, so people could go to your website, take the quiz, look at your advice, and get your book. So
right, so they can go to Better Brain. For my Better Brain quiz, you can go to my website, drmasley.com. drmasley.com. Right there it says take the quiz. It's free, and if you take it as a bonus, I'll send you my Better Brain shopping guide. You get my 12 foods to buy when you go to the store, my 12 foods to avoid so you don't hurt your brain. That comes for free with it. So don't hesitate. Take the quiz. See how you're doing. It's easy. It only takes about 60 to 90 seconds, and you can get an idea how you are. And again, no matter what your score or what your age, you can improve your brain function. So I think the first step is take the quiz, figure out how you're doing, get the shopping guide for free that comes with it. And then the book is available wherever books are sold. You know, you can go Amazon, Barnes & Noble, your local store, wherever you want, you can go to get the book. So that's available everywhere.
Yep. And I really enjoyed the book. I thought it was very enjoyable to read. It was very easy to follow. Sometimes you read these books and you're overwhelmed and you think like, yeah, no, I can't do this. But this was just real practical, easy steps to take. And again, I thank you for raising this as an issue. I think working in the field with Alzheimer's patients and with caregivers, we need to look at this seriously as a country and within our own families. So I thank you for raising this issue and writing such a great book about it.
Well, I thank you for the time to share with your followers and try to make a difference in their lives, help them feel fantastic, and protect them from the scariest disease in the world today.
Yeah, wonderful. All right. Well, you have a wonderful rest of the day, Dr. Masley. Thank you again.
All right. Thank you again.